The virus is spreading across California. That has cause for concern because it has no vaccine and no clear treatment.
Our Hunter Sowards is live in Westwood tonight with the virus that's hard to kick and advice from doctors. Hunter.
Yeah, Ruta Bay, Pat, I mean, take it from me, this one really does knock you out, and it can keep you down if you're not taking steps to prevent some of the worst of these symptoms. Now, wastewater in Northern California is actually showing that the virus is spiking there. Experts I talked to today said that is a clear indication that things could be moving south. It's a common sound during peak cold and flu season, but there's something circulating the Golden State that's neither of those things. It's called the human metapneumovirus, or HMPV.
Wherever you may be in LA, you're at risk.
Wastewater samples show high levels detected in northern and central California, and while levels are moderate locally, experts predict it's likely making its way south.
You can catch it from other people, lots of hand washing, because it is a virus that will knock you out.
UCLA's Dr. Ryan Aronin says the virus is much like a common cold. Symptoms include a runny nose, sneezing, and a cough. At this point, there's no vaccine to prevent HMPV and no clear treatment plan to help people feel better.
We worry about it in our patients who are the most vulnerable. The very young, the elderly, patients with immunodeficiencies, our immunocompromised patients.
It's nothing to be played with. You really have to take this serious.
For Natalie Moore Taylor, who suffered from COVID-19 before a vaccine was available, she wants everyone to be more aware.
Self-care, it should be a priority. And the care for your family, people around you.
HMPV isn't a new virus. First detected in 2001, doctors say the pandemic lowered immunity, fueling a resurgence. And just because there's no treatment doesn't mean you shouldn't get checked out if symptoms linger.
If you wait too long, 3-5 days, and you don't get seen, a superimposed infection, superimposed bacterial pneumonia, 100% would be worried for you.
With levels still low in Southern California, it's a cautionary tale for everyone to take the necessary steps to keep it that way.
Be aware. Be very aware.
Yeah, be aware. And we know those steps include, of course, washing your hands frequently, wiping off any counters or surfaces, and not going out into those large crowds or even into the office if you are not feeling well. We have a good bit of news, though, here. Apparently, this HMPV spreads best during colder weather. We had that warm up last week in Southern California, and experts tell me that likely helped curb some of the cases. Reporting live tonight in Westwood, Hunter Sowards, CBS LA.
All right, thank you so much, Hunter.
A health alert for you tonight. Grissom High School in Huntsville is confirming to us today that a student at the high school tested positive for tuberculosis and will not be returning to school until further notice. We've also learned students who have potentially been in contact with that student have the choice of getting tested for TB. News 19's Tony Cortez spoke with a pediatrician about the risk of this illness. Tony?
Pediatric hospitalist Kim Middleton says that while TB typically isn't found here in the U.S., it's usually found in underdeveloped countries. A spokesperson for Huntsville City Schools says a student tested positive for TB over spring break. The administrator confirmed that the student will stay off campus until further notice. Staff members at Grissom High are working with the Alabama Department of Public Health to offer free TB testing on April 2nd to students whose families want them to get checked. Dr. Kim Middleton recommends talking with a healthcare provider.
I would recommend that if there are concerns that they talk with their primary care doctor, because at the end of the day, their primary care doctor would know who they would be at risk for and then what to do with those results.
Tuberculosis is a bacterial disease that spreads through the air and can affect the lungs, brain, kidneys, bones, and eyes. It comes in two different forms, active TB and inactive TB. Inactive TB doesn't show symptoms and isn't contagious, but can activate at any time.
It can lay dormant in the body. It can never show you any symptoms, and you are in that state never contagious, but it is still important to treat it.
There are two ways to find out if you have TB, a skin test and a blood test, which is more accurate. The Madison County Health Department will be doing blood tests for Grissom students who opt into the screenings on April 2nd. Treating the disease can take weeks. It can be especially difficult for people who are immunocompromised or have an underlying chronic medical condition.
Chronic, at least 2 to 3 weeks of cough, fever. Typically, people would show weight loss or difficulty with gaining weight, fatigue, night sweats. Those would be signs and symptoms to be concerned of, to talk with your primary care doctor about.
Doctors recommend that people with TB quarantine to prevent the spread. Grissom students who get tested on April 2nd will be given their results the following week. If they test positive, they will be given further instructions on how to treat the disease.
The CDC says rotavirus, a life-threatening and highly contagious virus, is surging across the country. We checked in with local doctors who say they're starting to see it here in Northeast Kansas. Here's what you should know. Rotavirus is a stomach virus that typically affects very young children under 5 years old. Symptoms include vomiting, fever, and diarrhea. The CDC says symptoms usually start 2 days after exposure and can last up to 8 days. Experts say the best prevention is to wash your hands frequently.
Ways to keep it from spreading is really washing your hands and washing surfaces. We see big outbreaks in childcare settings, schools, that kind of a thing, because kids aren't always the best at washing their hands, unfortunately, and then obviously dirty diapers cause that as well.
Right now, the CDC is investigating a multi-state outbreak of salmonella infections linked to backyard poultry. So far, 34 people have gotten sick across 13 states, including New Hampshire and Maine. Officials warn ducks and chickens may appear to be clean and healthy, but can carry salmonella germs, and those spread easily. They say you should always wash your hands for 20 seconds after touching birds, their supplies, or collecting eggs.
Well, there's a warning from doctors about ticks and the risk of Lyme disease. This with spring now in the air and more people, of course, heading outside.
Yeah, health reporter Stephanie Stahl joins us now with more on what's being called a growing risk.
Yes, the tick population is growing big time. You know, experts say the tick population is actually exploding, and that increases the risk for Lyme disease.
I think there are definitely more ticks.
Lauren Klingsberg is looking forward to spending more time outside, but is worried about ticks and the threat of Lyme disease.
I garden and I have a dog, so I'm out a lot and I get ticks on me all the time.
The CDC says yearly almost 500,000 Americans are diagnosed and treated for Lyme disease, the most common tick-borne illness. This map shows cases of Lyme disease are concentrated in the Northeast, with Pennsylvania and New Jersey among the states with the highest numbers.
We see a steady increase from year to year, and we expect it to be the same last year and then this year.
Experts say a warming climate is increasing the tick population, and while a bad winter can kill ticks, heavy snow cover this winter actually provided the insects with plenty of moisture.
That keeps them alive, and that's why we are expecting that it's going to be a bad season.
Doctors say people should take precautions.
My recommendation is stay away from any vegetation. Stay on the trails. Don't touch anything in terms of limbs or branches or certainly vegetation where they're waiting to latch onto you.
Lyme disease symptoms that are flu-like can start from 3 to 30 days after a tick bite. The bullseye rash is seen in about 75% of cases.
I use permethrin-treated clothing. I tuck my socks into my pants and use insect repellent. And I try to keep my dog out of anything green. I will walk him either in the middle of the path or on the beach.
Dogs can also get Lyme disease, and ticks can spread from their fur to people, which is why it's important to use tick prevention products on animals.
An outbreak of Legionnaire's disease is under investigation at 2 well-known Las Vegas hotels after 5 guests fell ill after their stay. The Southern Nevada Health District is investigating the cases at the South Point and the Grandview hotels. 3 people who stayed at the Grandview, 1 in February and 2 in April, were hospitalized. 2 others stayed at South Point, 1 in February, the other in August of last year. Officials say multiple water samples from both hotels tested positive for Legionella, the bacteria that causes the disease. Both hotels are testing and treating their water systems. The health district gave insight into how they are treating the water.
So the 2 primary tactics that are used to eliminate Legionella bacteria from your water systems are a disinfectant inside the water system itself, and we'll see chlorination, sometimes monochloramine, things of that nature. And the other tactic that is often used is routine flushing of the water system.
Legionnaire's symptoms can appear 2 to 10 days after exposure and include cough, fever, muscle ache, shortness of breath, and headaches. The health district says if you visited either property before May 7th and you feel fine, there is no need to worry.
Legionnaire's disease in Las Vegas at the Wynn Hotel and Casino. What? Listen, I don't even know what Legionnaire's disease is. I'm going to have to look it up, but it sounds bad. They had 2 cases, one in September and one in February. One in September and one in February. Now, the people both recovered from their disease, okay? But they are now testing the Wynn, taking samples, and the Wynn is cooperating, doing different things to help the process. That's what they're saying. Now, they're saying if you stayed at the Wynn, I guess there's a survey. You can go to the site. There's a survey you could take to see if you got any symptoms, if you're feeling sick. Usually the symptoms start right away between 1 and 10 days. That's what they're saying. So again, if you stayed at the Wynn, 2 cases of Legionnaire's disease, there's a survey they want you to take, and if you're getting these symptoms, get some medical attention. Folks, I'm going to stay away from the Strip at least for a couple weeks. I don't want Legionnaire's disease.